So in this tutorial, I'm going to talk about some specific vertebrae, and we're going to start with a cervical vertebrae. There are 7 of them. They are the smallest and most delicate. They have a couple of qualities. One is an extra set of holes. So if you see these transverse foramen, you can be sure that you're looking at a cervical vertebrae. They also have sort of a funny bifurcated or split spinous process. So in addition to being small, they have an extra set of holes, and their spinous process is actually sort of irregular. So if you see those, you know that you're looking at a cervical vertebrae. There are 2 cervical vertebrae that I want you to recognize all by themselves. The first one is C1. C1 is also known as the atlas, and what you should recognize is that there is no body of this vertebrae. It is just literally a ring of bone. It still has those extra set of transverse foramina like all cervical vertebrae, but because it doesn't have a body, it's quite distinctive. The second cervical vertebrae is known as the axis, and you can see that it gets its name from this superior jutting structure called the dens, or the odontoid process. So that process is actually an anterior-facing structure, and your skull will pivot around it, giving you the side-to-side mobility of the head. So it still has the extra transverse foramen, a bifurcated spinous process, but because it has that tooth-like structure sticking out of it, it's quite distinctive.